Calcium delivery to the bones is essential for bone health. Guys, a lot of you come to me and ask me questions about calcium, joint pain, bone problem. Calcium does not go to your bones directly. So you need to take a good source of calcium that is doctor prescribed. The reason I say good is because all calcium are not equal. As I have said many times in the previous videos, there is calcium carbonate, calcium citrate. Usually calcium citrate is better and calcium carbonate is not good. That is at least our opinion. Because when you take calcium, if it stays in your gut, it's not good. It creates GI issues. So you need to take a good absorbable calcium. And when you take calcium, you want to make sure the calcium from your gut ends up in your blood. The way it does that is you have to take a vitamin D3 because all vitamin Ds are not equal. You need to take D3, that's number one, absorbable. Number two, from a good source, meaning pharmaceutical grade, doctor's grade calcium, the expensive stuff. There is a reason behind that because you put it in your body, you want it to work. So from your gut ends up in your blood. Now, when it ends up in your blood, you need to take a vitamin that takes it from your blood and takes it to your bones, and that's vitamin K1 and K2. So you need to take vitamin D, you need to take K1 and K2 in most cases to take the calcium that's in your blood to your bone cells. And we recommend vitamin E. Why? Because vitamin E, at the same time, it increases osteoblastic activity, meaning formation of bone, and decreases osteoclastic activity, which means destruction of bone. So this is a whole system that needs to be maintained properly. That is why people come to us, because they need functional evaluation for their functional problem, and they need functional medicine physicians. Our doctors who practice functional medicine, they are very familiar with this process. They are familiar what test to order, how to read the tests, based on the results of the test, what vitamins and supplements you can receive. From what companies? In most cases, vitamin D is bought from one company versus vitamin E from another company versus vitamin D from another company based on your individual needs. If you have joint pain, most likely we give you anti-inflammatories, glucosamine, chondroitin for joint cell construction. You follow me? Where if you have bone issues, it depends. Bone issues, we give you calcium, vitamin D to increase the osteoblastic activity and formation of bones. Joint issue, it's a different story. Some of you have both of these problems. So if you have osteopenia or osteoporosis, you better take a good source of calcium. First, you better see a physician who understands this. Second, be under the care of a physician who understands vitamin deficiency. What vitamins and calcium that physician needs to give you to increase your calcium. Not only just take the calcium, but because what good does it do if it doesn't get digested? What good does it do if it doesn't get absorbed? So you need to have an absorbable vitamin, absorbable calcium, then vitamin D with it, vitamin K1 and K2, and vitamin E. We have had many patients who are on antacids. Antacids, Tums. It advertises it has calcium in it. So you may think it's good, but it's horrible. It's destructive. Why? Because when you take Tums, in your GI tract, it finds its way to your bloodstream. In your bloodstream, calcium carbonate, which is what's in Tums, your body doesn't know what to do with it. Guess what? Stays in your blood. It causes plaque. It causes narrowing of your blood circulation and blood vessels. Remember that? Cholesterol. You want to lower your cholesterol. Why? Because they want to make sure you don't have plaque, you don't have inflammation, you don't have plaque buildup within your arteries. So it's essential to see a doctor who understands this, and do not self-diagnose. My name is Dr. Maz from Medwell Functional Medicine. You need to get tested first. You need to see a physician. This was an educational video. If you have any questions, don't forget to let us know. God bless.